Hello everyone. In the series of oral physiology, today I would like to introduce you to the physiology of swallowing. After learning this lesson, you would able to define the swallowing, describe and explain the stage and neural control of swallowing, state and explain the stability of the mandible during swallowing, and distinguish between normal adult swallowing and infant swallowing pattern. Content of our lesson today includes the introduction, the swallowing processes and their neural control, the mandible stability while swallowing. About the introduction. Swallowing is a sequence of coordinated muscle contractions that move food bolus from the oral cavity through the esophagus to the stomach. They include the active, voluntary, and reflex muscle activities. The decision to swallow depends on the smoothness and lubricity of the food bolus. As mentioned in the topics of mastication, in order for the swallowing process to proceed smoothly, the food must be cut and ground to an appropriate level, mixed with saliva to form a food bolus. And the saliva is also a component that helps lubricate the food bolus so that swallowing can occur. Swallowing is a series of reflexes in order to push the food through the digestive tract and protect the airway from food entering. I think most of us don't pay attention to how many times we swallow in a day, and the number of 590 times swallowed per day may surprise you. We not only swallow when eating or drinking, but also between meals, it means while awake, and even when sleeping. There are three phases of swallowing, include the oral phase, pharyngeal phase, and esophageal phase. The food bolus moves down from the oral cavity to pharyngeal, then to esophageal. On the path of food bolus, there are a rhythmic coordination of muscles in corresponding area as the food bolus moves, and the activities in these muscle areas are controlled by the neural system. After the food is chewed and formed into a food bolus in oral cavity, the swallow is active. The tongue will move the food bolus placed on the back of the tongue and gently pressed against the hard palate. At this time, the tip of the tongue rests on the hard palate just behind the upper incisors. The lips is closed, and the upper and lower teeth contact with each other. And a reflex contraction way of tongue compresses the food bolus posteriorly to pharynx. The activities that take place during the oral phase. The activity movements of oral phase take place under the control of central nervous system, that the first afferent fibers of the 5th, 7th, and 9th nerves transmit information about the general sensations like the touch, temperature, and pain sensation, and the taste also to brainstem. At this area, the first afferent neurons will synapse with the second afferent nervus of the sensory nucleus of the 5th nerve and solitary tract nucleus. Then the second afferent neuron transmits information to higher center as thalamus and sensory cortex for interpretation and processing. Final pattern of action from the motor cortex will be transmitted by afferent fiber to the motor nuclei of nerves to create the mouth movements which transmit food to pharynx smoothly. Next, the pharyngeal phase occurs very fast, just about 1,000 seconds, with many involuntary actions. The stimulation in the back of the mouth and pharynx create a series of reflexes. The pharyngeal muscles contract toward the esophagus. The soft palate is raised to touch the posterior pharyngeal wall in order to cover the nasal airway. The myohyoid muscles contract to move hyoid bone larynx complex upward and forward. So the epiglottis close and the vocal cord close too, to prevent the foot from moving into the respiratory tract. Concurrently with the esophagus expands to follow the foot to pass through. In pharyngeal phase, tactile or pressure information from the food or liquid in pharynx are transmitted by the pharyngeal flexors from the 9th, 10th, and 11th nerves to solitary tract nucleus in brainstem, then to the swallowing center in the medulla oblongata. In the swallowing center will dictate appropriate muscle coordination. The swallowing center is located nearby the chewing central portion. The generator in the medulla oblongata. The swallowing center can be influenced by higher center, which especially cortex, and it is also regulated by information from the periphery. From the swallowing center, the afferent nerves related to many motor nuclei from the midbrain to posterior medulla include the nerve 5, 7, 12, 10, 9, and 11. These nerves control a chain of actions of many muscles in pharyngeal phase. Results of the chains of muscle action is the nasal cavities is blocked and the larynx move up so that the vocal cord is closed, and that occur a temporary apnea. It means that no breathing during swallowing. The esophagus is open, and the contraction of the pharyngeal constriction muscles create a chain to pressure from the top to bottom. In order to food bolus is pushed down to esophagus. In esophagus phase, the food bolus pass through the entire length of the esophagus. It takes about 6 to 7 seconds for this phase and enter the stomach by peristaltic ways. When the food bolus reaches a certain part, that part expands. The upper part it contracts so that it creates a small pressure pushing the food bolus down. When the food reaches the cardia opens and then the food bolus enters the stomach. When the food bolus passes the level of collarbone, the activity of muscles in this esophageal phase or the soft palate lowers, the larynx moves down, the epiglottis open, then the esophageal sphincter tightens, and the tongue forwards, lower jaw in resting position, and the airway is restored. So, the swallowing is a continuous process consisting of 3 phases. However, during swallowing, the airway remains normal in the oral phase and esophageal phase, except for the pharyngeal phase. In pharyngeal phase, the soft palate is raised to touch the posterior pharyngeal wall, covering the nasal way, close the bases of the nose, and the larynx move up and vocal cords are closed so that the bases down the larynx closed. These movements help to protect the airway from the food while swallowing. The passage down the esophagus open. The swallowed tablet is pushed down to esophagus, After that, the subbalance descends, the larynx and pharynx reopen. The upper esophageal sphincter returns its usual closed state after the bolus passes. In a normal swallowing, the mandibles should be stable. The mandible stability is an important part of swallowing process. For construction of suprahyoid muscles to move the hyoid pole larynx complex upward and forward, this is essential in swallowing. There are two different swallowing patterns depending on the way to stabilize the mandible. They are adult or mature swallowing pattern and infant swallowing pattern. The adult or mature swallowing pattern, the lower jaw is stabilized by contacting of the lower and upper teeth in the intercuspal position or retractive position. But with the infant swallowing pattern, the lower jaw is stabilized by placing the tongue anteriorly and between two dental arcs of gingival ridges. The infant swallowing changes to adult swallowing when the posterior teeth erupt and fit together. The normal transition from infant swallowing to adult swallowing at about 2 to 12 years old. But in some cases, people prolong infant swallowing pattern for some reason, such as the loss of tooth support or tooth loss, or sometimes when they feel discomfort when teeth contact together in case of tooth decay or sensitive tooth. And in some cases that with mouth breathing or prolonged tongue sucking or anterior open bite ejector right. And the prolonged infant swallowing pattern can lead to anterior open and forward displacement of anterior teeth. In adult swallowing pattern, the duration of tooth contact when swallowing is about 0.7 seconds. It takes 3 times more than tooth contact when chewing, and the force applied to teeth when swallowing is about 30.2 kilograms. There are some notes about the swallowing process that during swallowing, the sphincters of larynx stay contracted, preventing aspiration of food into the air passages. During the pharyngeal state of swallowing, the larynx is elevated towards the lower jaw. This elevation opens up the cricopharyngeal sphincter, thus the facilitating swallowing. And the hyoid bone rotates in such a way that the greater corner becomes horizontal, producing a backward tilting of the epiglottis towards the posterior pharyngeal wall. This movement of hyoid bone effectively closes the laryngeal inlet. I've just introduced the physiology of swallowing. In summary, after learning this lesson, you would able to define the swallowing, describe and explain the stage and neural control of swallowing, about the reflex muscle activity, as well as the stage and explain the stabilities of mandible during swallowing. And you also may able to distinguish between normal adult swallowing and infant swallowing pattern. Thank you for your attention. See you in the next lesson.